How can you tell if a health influencer is legit or full of shit? Heel pain and footwear edition.
Some of the red flags to look for are they're making all or none statements.
You see, the main cause of this foot pain comes down to the shoes we wear.
When it comes to plantar fasciopathy, there are so many different risk factors that exist, which is why so many different people respond to different treatment interventions. Footwear is only one small piece of the puzzle. This is why you will have so many different people that can have the same diagnosis or the same condition, but they will have different responses to different treatments.
They're selling you something that is related to the claims that they're making.
Introducing the greatest weightlifting shoe ever made.
Number 4, if they have an obvious conflict of interest.
2 years ago, I teamed up with Tier to design the L1.
Last but not least, if they're speaking way outside of their area of expertise.
A lot of people wear shoes like this that are raised in the heel and raised in the toe. This basically puts the foot into a really bad position that stretches out the entire bottom part of the foot. So we're raising right here and elevating the heel. We've got a lot of stretch on the plantar fascia.
Incorrect. A higher heel drop, offset, or pitch actually decreases the amount of tensile load on the Achilles tendon, which subsequently decreases the amount of tensile load on the plantar fascia. And then when it comes to the flexed position of your toes in your shoes, your feet actually sit quite flat in a pair of runners, even if it has a very large forefoot rocker. And this actually decreases the amount that your toes have to flex when you are walking and running because the shoe is doing more of it for you. And because your toes are going through a reduced range of movement, there is less tensile loading being exerted on the plantar fascia when you're in a shoe that has a forefoot rocker and a higher degree of midsole bending stiffness. So he's earned a big fat F for failing footwear and biomechanics. All right, let's put him to the test for anatomy, physiology, clinical application of research, and logic.
A recent study showed that when the big toe is pushed inwards, the same way it's positioned within many narrow shoes that we wear, blood flow to the lateral plantar artery of our foot is diminished, meaning that tissue healing is greatly decreased at the bottom of the foot.
How does this relate to plantar fascia pain? Now what happens is that when the foot is held for an extended period of time in an elevated and adducted position, a muscle called your abductor hallucis is pulled tight. And when it is pulled tight, the lateral plantar artery is actually pinched off and blood supply is limited to the bottom of the foot.
But 16 of the participants actually had an increase in blood flow when the toe was moved into adduction. So it does not mean that the position of your big toe is going to shut blood supply off to anything and cause plantar fasciopathy. So for anatomy, physiology, clinical application of research, and logic, also awarding him a big fat F.